It's Friday, February 12th, and this is your Barbados Today Evening News Update. Another elderly Barbadian has died from COVID-19, bringing the death toll to 21. According to the COVID Communications Unit, the man was taken to the Queen Elizabeth Hospital on February 7, and 2 days later, he was transferred to the Harrison Point facility, where he passed away after 2 days. Health Minister Lieutenant Colonel Jeffrey Bostic has expressed his condolences to the family, while noting that the death came on the day the national COVID-19 vaccination program was rolled out. He stressed that the vaccine was safe and urged Barbadians to take the opportunity to protect themselves from the viral illness. Meanwhile, there were 43 new positive COVID-19 cases out of 250 tests conducted by the Best Santos Public Health Laboratory on Thursday. The 43 new cases comprised 20 women and 23 men. 5 of them had already been at the Harrison Point isolation facility. Of the remaining 38 cases, 35 are Barbadians and 3 are non-nationals. 40 people also recovered, bringing the number of active cases to 339. The total number of people diagnosed as positive at Her Majesty's Prisons DODS is 363. Of these, 361 have recovered. To date, Barbados has recorded 1,947 COVID-19 cases and 1,587 people have recovered. The Public Health Lab has so far completed 110,086 tests. Meanwhile, Purity Bakery closed its operations today after 3 employees tested positive for the viral illness. The company said affected employees are receiving care in isolation and primary contacts are in self-isolation. All staff will be tested. Management assured all protocols are strictly adhered to at the bakery, and it is working with the COVID-19 monitoring unit to ensure the company can resume production. Mass immunization got going at the Queen Elizabeth Hospital this morning, with nurses saying it's a necessary act to save lives. The healthcare workers received their first dose of the AstraZeneca vaccine, while those stationed at the Harrison Point isolation facility in St. Lucie got theirs on Thursday. Registered nurse Aisha Brathwaite, who is attached to the Accident and Emergency Department, told Barbados Today it's critical that healthcare workers and Barbadians get vaccinated.
What prompted me is that I think at this critical juncture, which we've watched all over the world, where healthcare members and patients have significantly been affected and are more critically ill, that we are in a better position because we do have a vaccine that can sort of reduce these numbers that we've been seeing currently. As I am one of the persons who take care of patients with COVID on a day-to-day basis, I've watched my colleagues and patients have to suffer with COVID. And if there's something that can significantly reduce the risk of me having the worst side effects, I'm going to take that percentage. Okay, so we need to flatten the curve.
A local medical practitioner who's on the front line on the fight against COVID-19 is pleading with Barbadians to stop seeking medical advice from social media hearsay. Dr. Ria Corbin-Hart, the isolation facility's client relations and activities coordinator, was speaking against the backdrop of a video making the rounds on social media that implied that the COVID-19 vaccine administered to Governor General Dame Sandra Mason yesterday was not real. Dr. Corbin-Hart explained that using a smaller needle on a patient compared to the one used to extract the vaccine from a vial is a well-known practice in medicine.
It was proposed that given that the color of the needle used to vaccinate our Governor General had changed, that there was an insinuation that she did not actually receive the vaccine. But this can be perfectly explained based on what we have been taught in the healthcare service. To give an explanation, needles are changed for 3 reasons. 1, size. So a larger needle is used to draw up the medication, and a smaller needle is used to inject the patient to reduce trauma. The other reason would be sterility. After you've drawn up the medication through the bung of the bottle, that is considered now not fully sterile, so you change to a new needle to be 100% sterile when injecting the person. And the third reason is we want a tip that is 100% sharp, because contrary to popular belief, the sharper the tip, actually the less trauma you get and the less it hurts.
Dr. Corbin Hart is advising Barbadians to seek their medical advice from trained personnel and institutions who can offer advice based on science.
As we keep mentioning, try to make sure information is from reputable sources. When videos, articles, or any other information comes out and it is from a reputable source, they usually do indicate their name. So they will either say CDC and a year or a month, something. If you have a video that comes out and it has no signage on it, you have to really wonder, how reputable is it? And the other thing is that this video, if none other, is the best example where persons can see what they want from everything that has happened or from anything that has happened. So I'm basically saying you have to use your own thought to decide what makes sense to you before you run with a video or forward it, etc.
There's regional and international news after this short break.
Barbados Today, news you can trust.
On the regional scene, Jamaica's Health Minister, Dr. Christopher Tufton, warns that hospitalizations are at an all-time high as COVID-19 cases spiral out of control. He, however, says the provisions are being made to ramp up bed capacity. Shamala Pullin of Television Jamaica reports.
More than 80% of bed spaces are occupied at public hospitals as the country continues to grapple with an increase in COVID-19 cases. Speaking at a media briefing on Thursday, Health Minister Dr. Christopher Tufton says this is worrying.
Currently, some 309 of the approximately 362 COVID-19 beds across the island are occupied, making the occupancy level for COVID-19 beds the highest it has been to date at some 85.4%. So occupancy of our COVID wards, these are wards that we constructed in the early days of COVID back in February, March and beyond.
Dr. Tufton also said that the field hospital that was donated by the U.S. government and was installed at the National Chest Hospital will be relocated to the Spanish Town Hospital because that facility is overwhelmed. The health minister also said that additional beds will be available at two field hospitals built at Falmouth in Trelawney and St. Joseph's Hospital in Kingston.
On the international front, U.S. pharmacies, including Walgreens and CVS pharmacies, will begin delivering COVID-19 shots. More in this report from Reuters Television.
At a pharmacy in Chicago, visitors rolled up their sleeves to get a first dose of a COVID-19 vaccination. Walgreens and CVS pharmacies this week will begin inoculations against the novel coronavirus.
All right.
Jamie Stranatka is this Walgreens pharmacy manager.
I'm really excited to be a part of this and to be a part of the solution. It's really great when patients come in. They're so thankful and happy to finally get the vaccine, and it's nice that this is the beginning of the end of the pandemic.
The White House this week began coordinating shipments of vaccines directly to 6,500 pharmacies with the goal of reaching about 40,000. Vaccine distribution comes at a critical time in the United States, with officials expecting the country's coronavirus death toll to soon reach 500,000. Stadiums have been converted into vaccination sites. Two new centers were readied in Oakland and East Los Angeles this week to serve minority populations.
Each of them is going to be capable of providing 6,000 vaccinations per day.
Grady Joseph is with the California Office of Emergency Services.
Our goal is to get these set up quickly and then be able to scale them to be able to meet the needs of the particular communities that we're working to serve.
The U.S. government is already ahead of pace to meet President Biden's goal of 100 million shots in 100 days. But the rollout has hit problems as states scramble to distribute federal deliveries. 2 months ago, state officials had a surplus and doses sat unused. Now they say they face a shortfall. Weekly shipments are now up to 11 million, up from 8.6 million when President Joe Biden took office.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as Screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.